Hello, and thank you for taking the time to view this presentation. My name is Hannah Shortreed, and on behalf of my co-authors, Megan Clark, Rabail Siddiqui, and Alexei Asayev, I would like to take the time to present to you our topic entitled Assessing the Role and Influence of Cardiac Imaging on Breast Cancer Care in Northwestern Ontario. With regard to disclosure of affiliations, financial, and in-kind support, this project received support from the Mock Gainsland Foundation Summer Student Research Grant. In addition to this, our co-authors Alexei Asayev and Rabail Siddiqui are current employees of the Thunder Bay Regional Health Sciences Center, and Hannah Shortreed and Megan Clark are currently students enrolled in the NOSMU MD program. With respect to financial support, this session did receive funding from the Mock Gainsland Foundation in the form of this 2024 Summer Student Research Grant. Now, regarding our topic on assessing the role and influence of cardiac imaging on breast cancer care in Northwestern Ontario, I would like to begin with a brief introduction. In Canada, over 25,000 women are diagnosed with breast cancer each year, and survival continues to improve thanks to advances in screening and treatment. However, many of these treatments, particularly anthracyclines and trastuzumab, carry cardiotoxic risks. As a result, cardiovascular disease has become a leading competing cause of death amongst older breast cancer survivors. Baseline assessment of left ventricular ejection fraction, or LVEF, is known to be predictive of heart failure in these patients, and national guidelines recommend pretreatment imaging. That said, most cardiac imaging recommendations are based on expert opinion rather than robust data. This study aimed to evaluate the real-world effectiveness of cardiac imaging in breast cancer patients receiving anthracyclines and/or trastuzumab in Northwestern Ontario. Given the region's limited resources, our goal was to assess whether tailoring imaging based on patient-specific risk factors could improve outcomes and guide more efficient use of healthcare services. With respect to our methods, we conducted a retrospective cohort study of all female breast cancer patients in Northwestern Ontario treated with anthracyclines and/or trastuzumab between June 1st, 2014 and December 31st, 2017. We collected data on demographics, treatments, cardiac imaging tests from diagnosis to 1 year post-treatment, and clinical outcomes. Patients were divided into 3 cohorts. Cohort A received trastuzumab only, Cohort B received anthracyclines only, and Cohort C received both treatments. Our primary outcome was the yield of cardiac imaging, defined as the proportion of scans that led to a change in care. Secondary outcomes focused on identifying predictors of high-yield imaging. 93 patients met the exclusion criteria for this analysis. Our figure flow is depicted in Figure 1. Cohort B, the anthracycline-only group, had the highest imaging yield at 13.3%, followed by Cohort A at 7.1%, and Cohort C at 4.2%. Please refer to Figure 2. Interestingly, the number of scans varied significantly. Cohort C underwent the most scans per patient, an average of 4.8, while Cohort B, despite its higher yield, had the fewest scans per patient, just 1.2. For secondary outcomes, we found that predictive variables for imaging yield differed between treatment groups, though Cohort A was excluded from this analysis due to its small sample size. Please refer to Figure 3. Overall, these findings suggest that anthracycline-only patients may benefit from more clinically indicated imaging during treatment, rather than routine imaging schedules. In contrast, trastuzumab-treated patients who undergo more frequent imaging per guidelines showed a lower yield. This disparity highlights the potential for overutilization in some cases and underutilization in others. In a region like Northwestern Ontario, where healthcare resources are limited, optimizing imaging based on patient-specific risk rather than treatment type alone may improve care and efficiency. Further research is needed, particularly in trastuzumab-only cohorts, to better define predictive risk factors. In summary, this study supports a more personalized approach to cardiac imaging in breast cancer care. Aligning imaging practices with individual risk profiles has the potential to improve patient outcomes while minimizing unnecessary testing and alleviating strain on the healthcare system. Thank you for listening to our presentation.